Shoulder replacement has changed dramatically over the last 3 to 5 years. We're now doing, most of them is outpatient surgery. Probably 80% of folks, they come in, they have their surgery done and go home safely the same day. But there's a lot of criteria you have to look at to see if you're an outpatient candidate. So there's a lot of work that has to be done before. One, you have to be relatively medically fit. You have to have a good coach or a help at home. And you have to have a home environment that's going to allow you to be successful. So the first step is, how do you set up your home environment for outpatient total shoulder? So the key is, you got to have a good coach or significant other or family member at home that can help you at least for the first 2 or 3 nights. If you live alone, not a good candidate, because you are going to need help the first couple of nights. So coach, a family member is key. The second thing is medical clearance. If you have significant heart disease, lung disease, any kind of severe medical comorbidities, this is not a good idea, because you'll likely need help in the hospital at nighttime. But the other keys are, as you're thinking about outpatient shoulder replacement, is your home environment. You really need to be on one floor. If your bedroom, bathroom, kitchen on one floor is ideal. We've had issues with people going home and their bedroom's on the second floor. They can fall down the steps. It's obviously not good. So if you can have a home environment that's on one floor, where you can get to the bathroom, you can get to the kitchen, and where you're resting, that's ideal. The second thing is where you rest. If you can invest or rent a recliner, that's ideal, because your position of comfort is going to be sitting up a little bit. There's all kind of fancy post-op pillows you can buy, but you really need to be in that sitting up position, because as soon as you lay flat, not going to be great. So if you can plan that and have a recliner or some ability to rest sitting up, that's ideal. Now, as far as we're concerned, to get ready for outpatient shoulder surgery, you have to have, most patients have a CT scan. We use that CT scan to put in our software, because almost every case we'll do your surgery virtually before we ever do your surgery. It's a fantastic accomplishment in shoulder surgery, because now we know the exact implants, we know where they're supposed to go. It makes us more efficient and helps you with your outcome. The other thing, the last thing we do before surgery, is you'll do a special HIBA cleanser soap scrub before. That hopefully cleans the bacteria off. That lowers the incidence of infection. So we do believe that the outpatient total shoulder is ideal if you're a candidate. Medically, your home environment and our preoperative planning needs to be perfect.